The Huron Gastro program, we try to treat obesity as a chronic disease. It's very complicated, and we try to hit all of the various elements that we think are important in significant weight loss, including telling them that the disease is complicated, its microbiome, its genetics, its metabolic rate, its hormones, etc. We provide behavioral and psychological support, and what we try to do is be very empathic and try to say all of these traumas that you may have felt as a consequence of your obesity, we can help reverse, and we can help give you an environment where you can have confidence, where you can be successful in losing weight. We, as medical professionals, also are very engaged in doing something positive, like taking medicines away. So if they have significant weight loss, their reflux goes away, their fatty liver goes away, their diabetes goes away, and we can start reducing medicine. So we're actively engaged in doing something that we typically don't do, which is to take medicines away rather than prescribe medicines. The multidisciplinary team is very important because, again, many touches are very important. So the patient feels like the doctor is caring for them, the physician's assistant's caring for them, the navigator, the nurse, the people at the gym, etc. There's so many eyeballs on the patient that the patient feels that they're really being cared for. And the medically supervised portion of it is very important, that we try to tell them that this is not a bad habit, but this is a medical condition that requires medical professionals to help treat. And the old paradigm of calories in equals calories out is wrong. And we tell them that weight loss is complicated, and that's why it's so difficult to be successful. So our program is medically monitored, multidisciplinary team, stimulus narrowing, behavioral modification is very important, and having a nutritional and exercise program integrated is extremely important. So one of the first things I ask any patient that I see in our office is I ask them, why are you doing this? And it's an important question to ask, because if the patient doesn't have a good reason for why they're doing this, I sometimes tell them, hey, this is not a good time for you to try. Because if they're not motivated, if they can't answer why they're doing this, then it's not worth the effort. And I say, hey, you know what, we really shouldn't start this. But if they have a good reason for why, that they have a medical condition, or they're having surgery, or they had a negative health event, then that's usually a good motivator. The other thing I ask them is write down the 10 happiest moments of your life. And it seems like a silly question, but one of the things that it's a good useful exercise, because when you write those 10 things that you say without thinking, what's the 10 happiest moments of your life? When they write it down, they'll notice that it's about people, it's about experiences, and experiences with people you care about. It's typically never about food. They never talk about, you know, I had a piece of apple pie and that made me so happy. My job is to give you more of these happy moments. And some of them I say, you know, why do you want to live? And if they say, well, I want to see my kid graduate from high school, or I want to walk my daughter down the aisle, or I want to take my wife on a vacation because I've been working for 30 years, then I said, well, if you want that to happen, you have to affect your health. And if you don't affect your health, your ability to walk your daughter down the aisle may not happen. And one of the other things we target is health and physiological age. So you could be 50, but your body age may be 65, 70. And I tell them the average man in the United States may live to 75. And if you're already 68, do the math. You may not have much time. And these are all motivating things that get people to want to engage in our program. So in conclusion, obesity is a complex disease that requires a multidisciplinary approach. And as gastroenterologists, most of us are going to be dealing with obesity-related problems every day. Now, I estimate that 40% of what walks in through my door every single day is obesity-related. The AGA has provided a great resource with the POWER program, and I would encourage all of you to read the white paper, which is based on assessment and intensive weight loss intervention, weight stabilization, and prevention of weight regain. The OptiFast meal replacements are an integral part of our program, and we've demonstrated in prospective randomized studies and based on our own experience that it has been very effective in convincing patients to be compliant, gives them a quick response that keeps them motivated. And we find that this is our best intervention initially to get them off to a good start. And we think developing a multidisciplinary, medically supervised weight loss program has a place in a GI practice, and we'd encourage you to consider starting a program in your practice. Thank you.